This shows where the suprasternal view of the aorta is taken. So the probe is up here now, and we're scanning through the aortic arch and the vessels, and then on to the heart beneath. So this is another view where we need to alter the position of our patient slightly, because we're going to scan suprasternally from the suprasternal notch. So Kim, if you don't mind, I'm just going to put these pillows underneath your shoulders and then ask you to extend your neck down like that. We need to be quite careful with this view. It's not particularly comfortable, and it's certainly not for the elderly if they've got stiff necks. And having pressure there at suprasternal notch is quite unpleasant, so it's always a good idea just to keep checking that the patient's feeling all right. So I will get my probe and make sure that the notch is pointing towards the left shoulder, and then I'll just position in the suprasternal notch like this. I can reduce my depth here. I think my width is about right. To find the view, sometimes it's useful to put some colour on, because the blue surge down the descending aorta that we see here can help you navigate yourself a bit. And what I'm looking for are the head and neck vessels up here. So 1, 2, and there will be one up here as well. That's what it should look like. This is a diagram of the suprasternal view of the aorta. Our probe will be at the top of the screen here. We're looking at the ascending aorta, the arch itself, and then the descending aorta here. We also get the head and neck vessels. So this first one is the innominate. Some people call it the brachiocephalic artery. Then we have the left common carotid, and then we have the left subclavian. Sometimes you can see the right branch of the pulmonary artery beneath the arch. So we're going to be scanning in the suprasternal view. So I'm pointing the probe notch towards the left shoulder, so I can see the arch like this. I'm going to have a hunt around for those head and neck vessels. They're not the easiest to see, and the colour Doppler hopefully will help me. So what I'm looking for